I realized today that I hadn't updated my graph of deaths by date of death, not simply report, right? Because there's a difference between when a death was reported. These red bars that you see here, those are deaths reported every day or added to the global or the cumulative tally of deaths by the Florida Department of Health. But they also publish through their dashboard a graph which is highly misleading because it has provisional data, right? So data for recent days isn't complete yet because we're still processing. Death processing takes a while. Certification of death takes a while. So these black bars are more reliable the further away they are from right now. So right now it's July 10th, and I haven't updated the graph for a while. So let's go do that. First of all, I'm going to update the references to not this data, but the reports of death for the bottom graph. So it so far only goes until the 27th of June. So let's bring it back to the latest report I have, which is I think it might be one. There might be one more. No, actually there isn't. Never mind. So I think this is death by reported on the 10th, but for the 9th, because the data is always for the day before, the day prior. So what we're seeing is a huge spike that happened on the 8th, reported on the 9th, 420 added deaths, and then today we're closer to 80 something or 90 deaths. So that's interesting, right, to see that. So clearly there's a trend up. This line that you see, the red line right here, is 7-day moving average, which means we're taking on a given day the average of the previous 7 days. So we're taking every single one of those, averaging them out, and they come down to this number because they're averaged by these lower numbers here. It's very important to do that because there are tons of reporting chunks that come out. So it can happen that during weekends, for instance, there's fewer deaths being reported because people are not working necessarily this weekend, or the workflow is slower because of a number of reasons. So as you can see, there's seasonality effects, not really seasonality, but weekly effects where there's dips of these reportings every week on the weekends. So we average them out so we get an idea of a trend that is clearer than just those bars. But what about the actual date of death, which we don't get from the line list that is provided by the Florida Department of Health? We are not given a date of death for every single case. So if a case becomes a case, which includes two very important timestamps, the date and time, actually the date that a case became symptomatic or became a lab confirmed positive result. That is called the event date. It's not great. It's actually terrible. It should be two separate dates. There should be a symptom onset date. So we know when people started reporting to their physician or to the hospital or testing site they went to, they first had symptoms on that date. They first noticed symptoms that were unmistakably COVID-19, or they were diagnosed without a test by a physician as having COVID-like symptoms, which are important and actually charted in hospitals, I believe. There's then the date of first positive result, which is very significant because it's not fuzzy. It's not up to interpretation. When a lab is positive, a lab result is positive, it's positive. So that's the problem with the event date. Now, there's another date, which is the case date, and that is when the Florida Department of Health adds a case to their internal storage system and reports it in a line list. So whenever a case is added, that's the date that appears as the case date. So those are tricky and confusing and can be dangerous to use. However, despite the fact that the Florida Department of Health does not include a date of death or a death date in the line list of positive people that they track, which is problematic because that means we have no way to determine for every single individual that has been reported as positive how long it took for them to go from being diagnosed having an onset of symptoms or having a lab result that is positive to the time they died. So that delta of time, the difference between onset or lab result and death, would be incredibly valuable for researchers, but we don't have it. It's likely that it's hidden from the line list for privacy reasons, because there is some loosely personally identifiable data in the line list. There's an age, a county, a gender, and some travel information sometimes to see where the people traveled before they came to Florida. Anyway, let's update this and see this slightly more reliable aggregate data that we get that is not the line list that we get from Florida Department of Health, but instead an aggregate list of group. Essentially, it's a list of days, and for a given day, how many people died on that day. So if I add that stuff, my last export was done today on July 10th. If I add this stuff, this is what we see. So I'll undo it and redo it so you can see what happens. There you go. So we go from this. So our belief, looking simply at date of death, might have been that, things were getting better by the 27th. It might look like things were getting better in Florida. Similarly here, if you look at that black bar, that's the equivalent. I'm sorry for switching colors on you, but the black here is the red here. If I now add the latest information we have from the last week, this is what it looks like. Do you see how mistaken you might be if you trusted that chart that is prominently displayed on the Florida Department of Health's website? And just not a good picture of what's going on right now. It's slightly less confusing these days because there's so many new deaths added that it only slopes down towards the end of the chart, in stark contrast with the cases added each day, which are an early indicator that the pandemic is having a resurgence. So now back to this. Sure, there are a ton more reported cases, right, that you see here, but also you see there are more actual deaths per day. This black line that you see, the 7-day moving average of the deaths by date of death, is going up. And again, whether it slopes down here is completely irrelevant because we don't yet know in the last week precisely whether all of the deaths that did occur in that time span have been reported yet. So it might very well be that in the next 5, 6, 10 days, we get more reported deaths and they get added to this tally and they make those columns increase and the 7-day moving average of actual deaths by day increase. I hope that helped.